coronavirus outbreak.
Coronavirus cases.
Coronavirus crisis team. Once again,
it's all over the news. The number of diagnosed U.S. coronavirus cases is steadily growing. But chances are those official stats that people keep quoting and you keep seeing underestimate the reach of the virus. And that might not be a bad thing. Hi, I'm Ana Ibarra, health reporter for CalMatters, and I'm explaining California's response to the coronavirus. Initially, the Federal Centers for Disease Control and Prevention only tested recent international travelers and people who had knowingly come in contact with infected patients. Then, there was a reported shortage of tests to screen for the virus. This left many, including people who experienced no symptoms and those who may have thought they had a cold or flu, untested. It also made tracking the spread a lot harder. Now, the CDC has expanded its testing criteria and sent California thousands of tests. As more people are tested, more cases will be reported. By the time state public health officials announced that they could screen more than 7,000 people, the number of people self-quarantined because of possible exposure was 10,000 and climbing. And some people, including healthcare workers now in isolation, report waiting days to be tested.
We don't have enough tests today to meet what we anticipate will be the demand going forward.
As the Trump administration and health officials scramble to catch up, more people are bound to learn that they have contracted the coronavirus. The World Health Organization estimates about 3% of worldwide cases have died. But as more people with previously undetected cases and mild symptoms test positive, the calculated death rate is likely to drop. Those at greatest risk? Older adults with underlying medical conditions, which may make it harder for them to fight off the virus. Governor Gavin Newsom declared a state of emergency in California. The state has thus far set aside $20 million to respond to the outbreak. This could help with testing costs, medical transport, and increased staff time. It's required insurers to pay the full cost of testing for the virus for millions of Californians. And it's made available 21 million face masks from its emergency reserve to help protect healthcare workers. While there's not yet any vaccine against the virus or cure for those sickened by it, experts say you can minimize your risk of exposure by frequently washing your hands for at least 20 seconds, using hand sanitizer with 60% or more alcohol content, and keeping your hands away from your face. If you're feeling sick, stay home, and if you fear that you may have been exposed to the virus, contact your doctor. You can keep up with California's response to the coronavirus by following our reporting at calmatters.org. For CalMatters, I'm Ana Ibarra.